All right, get ready to dive deep, everybody, because today we're tackling lung cancer.
Oh, yeah.
You asked for a clearer picture of diagnosis and treatment, and, well, we're using excerpts from a medical textbook on respiratory issues to guide us.
Perfect.
But, of course, this is just for you to learn, not medical advice.
Right.
So always talk to a doctor if you have any concerns, okay?
Couldn't agree more. Yeah, information is power.
Exactly.
But we have to use it responsibly.
Right.
That-
But I gotta say,
Yeah.
one thing that really jumped out at me from these materials was how doctors are looking for clues that seem totally unrelated to the lungs.
It's true.
Like, what? How does that even work?
Lung cancer can show up in some really surprising ways. It's
Yeah.
not always,
Yeah.
just a cough or shortness of breath.
Right.
Sometimes it's subtle,
Okay.
like finger clubbing.
Oh, yeah.
Have you heard of that?
Actually, yeah, my grandpa, I always thought he just had, like, funny fingers, but now I'm thinking maybe.
It's a classic example of how these things can go unnoticed,
Yeah.
Finger clubbing,
Yeah.
that's where your fingertips get all big and round.
Right.
It's a sign of low oxygen over time, which lung cancer can actually cause.
Okay.
Doctors also look for things like muscle wasting in your hands,
Really?
swollen veins in your chest and face,
Wow.
even like tar stains on your fingers. And here's a weird one, tattoos.
Tattoos? What? No way!
I know, right?
Really? I never would.
Specifically, like
Yeah.
radiation markings.
Oh, okay.
Doctors might see these tiny tattoos on someone's chest and be like, oh, this person had radiation for lung cancer. It's like
It's like a hidden clue.
like a secret code on their skin.
Okay. So let's say a doctor suspects lung cancer from these, like, initial clues. What happens next? What's the next step?
Investigation time.
Okay.
Think of it like a medical detective story.
I like that.
We start with blood tests.
Blood tests. I wouldn't have thought that would be helpful for lung cancer.
They're so important, though.
Really?
They can check for anemia,
Okay.
which could mean there's some bleeding from a tumor.
Oh, okay.
They look at your liver function, your kidney function,
Right.
which is really important before you start any treatment.
Makes sense.
And they can even look for specific markers in your blood that are, like, linked to certain types of lung cancer.
Wow.
It's crazy how much information we can get from just a little blood draw.
It really is. It's like a window
Yeah.
into what's happening in there.
Exactly.
Okay.
And then there's
Yeah.
spirometry
Spirometry. Okay.
that measures how well your lungs are working.
Okay.
Like how much air you can breathe in and out,
Mhm.
how fast you can exhale, that kind of thing.
Right.
This is so important for planning treatment
Yeah.
because it tells us like how much your lungs can actually handle.
Okay, that makes sense.
Okay.
So we've got blood work, lung function testing. What about imaging? Yes. I mean, I'm guessing x-rays are involved at some point.
You bet. A chest x-ray is usually the first imaging test.
Okay.
It gives us a general overview.
Right.
But for a closer look,
Yeah.
we use CT scans.
Now, I know CT scans use x-rays too.
Yeah.
But they create those, like, 3D images, right?
Exactly.
Yeah.
CT scans can create these super detailed pictures of your chest, your abdomen, your pelvis,
Okay.
showing the size of the tumor, exactly where it is, and if it's spread.
Mhm.
And for
Okay.
even more precision, especially with non-small cell lung cancer,
Right.
there's this thing called a PT-CT scan.
A PT-CT. Okay, I'm lost.
It's like a 2-for-1 deal.
Okay.
It combines the detail of a CT scan with information about the activity of cells.
Hold on. Activity of cells.
Metabolic activity, yeah.
Okay, so what does that mean in terms of cancer? I don't.
So cancer cells,
Yeah.
they're like little energy hogs. They gobble up sugar, nutrients, way faster than regular cells.
Oh, okay.
So a PT scan highlights those areas of high activity,
Okay.
which are often tumors.
So it's like a heat map of
Pretty much, yeah.
where the cancer is.
Yeah, and by combining that with the CT scan,
Yeah.
doctors get this really clear picture of what's going on.
Okay, so we've got all this information, right? From the blood tests, lung function, imaging.
Right.
But to really get a diagnosis, you need a biopsy, don't you?
Absolutely.
Yeah.
The biopsy is the gold standard. It's the only way to confirm
Okay.
that there are actually cancer cells.
And I'm guessing there are a bunch of ways to do a biopsy,
Yeah.
depending on where the tumor is.
Exactly. There's
Yeah.
bronchoscopy,
Okay.
where they put a thin tube with a camera into your lungs through your nose or mouth.
Yeah, I've heard of that.
And then there's guided needle biopsy,
Right.
where a needle is guided by imaging to get a sample from the tumor. The doctor chooses the best technique for each person.
It's amazing how precise medicine has become.
Yeah, it really is.
So let's say the biopsy confirms lung cancer.
Okay.
Now what? What's next?
Now we have to figure out exactly what kind of lung cancer we're dealing with.
Okay.
There's this crucial difference
Okay.
between small cell and non-small cell lung cancer.
Wait,
Yeah.
different types?
Yes.
I thought it was all the same.
That's a really common misconception.
Oh, okay.
And understanding the difference is super important
Okay.
because it totally changes how we approach treatment.
Okay. All right.
Yeah.
I'm all ears.
So non-small cell lung cancers are much more common.
Okay.
And within that category,
Yeah.
there are two main subtypes,
Okay.
adenocarcinoma
Got it.
and squamous cell carcinoma.
Okay. So what makes them different?
Well,
Yeah.
adenocarcinoma is often found in people who have never smoked.
Really? Yeah.
That's surprising.
Which might surprise you.
Yeah.
It tends to grow more slowly than some other types. Okay.
Squamous cell carcinoma
Okay.
is more linked to smoking
Mm-hmm.
and usually develops in the central part of the lungs.
Wow.
Yeah.
I had no idea. There were so many variations within lung cancer.
Yeah, there's a lot of nuance to it.
So the type you have really dictates the treatment then.
Absolutely.
Okay.
Treatment is tailored to both the type and the stage of the cancer.
So it's not a one-size-fits-all approach.
Not at all. It's very individualized.
And I'm guessing this is where, like, the expertise of a whole team of doctors comes in?
You got it. Decisions about treatment
Right.
involve a whole team.
Yeah.
Oncologists,
Mm-hmm.
surgeons, radiation therapists, pulmonologists, nurses.
Wow.
They all work together to come up with the best plan,
Okay.
taking into account your individual needs and preferences.
This is all fascinating, but to be honest, a little overwhelming.
Yeah, it's a lot to take in.
Are you ready to walk us through the treatment options?
Absolutely. But let's
Yeah.
take a quick break first.
Okay. Sounds good.
When we come back,
Yeah.
we'll explore the exciting world of lung cancer treatment.
Okay, I can't wait.
Yeah.
We'll be right back after this.
All right.
So before the break, we were talking about those different types of lung cancer, small cell versus non-small cell. And you said that makes a big difference when it comes to treatment, so let's break that down some more. What makes small cell lung cancer so different?
Small cell lung cancer, it's all about speed, really. It tends to grow and spread way faster than non-small cell.
Like it's on fast forward.
Yeah, exactly. It can spread to other places in your body, like your brain, liver, or bones, even before you have any noticeable symptoms.
That sounds really scary.
It can be, yeah. And because it spreads so quickly, surgery isn't usually an option.
Okay, so if surgery isn't possible, how do you treat it?
Well, the main treatments for small cell lung cancer are chemotherapy and radiation therapy.
So chemo uses those powerful drugs to kill the cancer cells all over the body, right?
Exactly.
Yeah.
And radiation therapy uses high-energy rays to target specific areas where the cancer is.
So they're often used together, attacking it from different angles.
Right. A combination approach can be really effective.
But I imagine those treatments are pretty hard on the body.
There could be some significant side effects with both chemotherapy and radiation, yeah? That's why it's so important to have close monitoring by your medical team and what we call supportive care to manage those side effects and keep you as comfortable as possible.
That makes sense. So that's small cell. Let's talk more about non-small cell lung cancer. We talked about the subtypes earlier, adenocarcinoma and squamous cell carcinoma. Can you break those down for us a little more?
Yeah, absolutely. It's important to understand those subtypes because, as I said, they behave quite differently and they respond to different treatments.
So let's start with adenocarcinoma. What's the main takeaway there?
Well, one of the most surprising things about adenocarcinoma is that we often see it in people who have never smoked.
Wow, that really challenges the idea that lung cancer is just a smoker's disease.
It does, yeah. Smoking is a big risk factor, obviously, but it's not the only one. Adenocarcinoma often starts in the outer parts of the lungs and tends to grow more slowly than some other types.
So slower growth, is that good news in terms of prognosis?
It can be. If we catch adenocarcinoma early, before it has a chance to spread, the chances of successful treatment are much higher.
So early detection is key, just like with any cancer. What are the typical treatments for adenocarcinoma?
If it's caught early, surgery is often the first line of treatment. The goal is to remove the tumor and any affected lung tissue.
And we talked about those different surgical approaches before, the lobectomy and pneumonectomy. Those are pretty incredible, but I bet it's a big decision to have that kind of surgery.
Yeah, you're right. It's a big decision, and it's not always the right choice for every patient. If surgery isn't possible, or if the cancer has already spread, then we might recommend chemotherapy, radiation therapy, or a combination of both. And, in recent years, targeted therapies have become a real game changer for adenocarcinoma.
Yeah, targeted therapies were one of the things that really stood out to me in the materials you sent. They seem so precise. Can you explain how they work?
Sure. They're designed to attack specific molecules or pathways that are involved in the growth and spread of cancer cells. So think of them as like guided missiles, homing in on the cancer while doing less damage to healthy cells.
That's amazing. Much more targeted than traditional chemo.
Exactly. And because they're more targeted, they often have fewer side effects than traditional chemo, which can be a huge plus for patients.
So we've covered adenocarcinoma. Now, what about squamous cell carcinoma, the other main type of non-small cell lung cancer? What makes it different?
Squamous cell carcinoma is much more strongly linked to smoking, yeah. And it typically develops in the central part of the lungs, near the major airways. It's important to distinguish it from adenocarcinoma because, well, they respond differently to treatments.
So even though they're both considered non-small cell, the treatment approach is very different.
It can be, yeah. But the good news is that for both types, if the cancer is caught early, surgery can be a very effective option. The goal is to remove the tumor completely, of course.
And if surgery isn't an option, what are the alternatives?
Well, we might use radiation therapy, chemotherapy, or a combination of both. And just like with adenocarcinoma, there are now targeted therapies available for certain subtypes of squamous cell carcinoma. So even though it's linked to smoking, there are more treatment options than ever before.
That's really encouraging. It sounds like there have been so many advances in lung cancer treatment, but I'm curious about the diagnosis process itself. How do doctors figure out the stage of the cancer, and why is staging so important?
Staging is really important because it tells us how far the cancer has spread. That helps us decide on the best treatment, and it helps us predict how the patient might do. You can think of it like a roadmap for the journey ahead.
Okay, how does staging work? Is it a complicated process?
Not really. Lung cancer is staged using what's called the TNM system.
TNM, what's that stand for?
It stands for tumor, node, metastasis.
Okay, tumor, node, metastasis. Break that down for me.
So T refers to the size and location of the main tumor. N tells us if the cancer has spread to any lymph nodes nearby. And M tells us if it has metastasized, meaning spread to distant organs.
So by looking at these three things, doctors can get a sense of how far the cancer has traveled from where it started.
Exactly. Based on the T and M factors, the cancer is given a stage from stage 0, which is very early, to stage 4, which means it has spread widely.
And the higher the stage, the tougher the treatment and the less optimistic the outlook.
Generally speaking, yeah. Higher stages usually need more aggressive treatment, and the prognosis is often not as good.
This is all making sense now. Staging gives important context for understanding how serious the cancer is and deciding on the best treatment plan.
Exactly. It's a fundamental part of managing lung cancer.
It's incredible how much we've already learned about the different types of lung cancer, all the treatment options, and the importance of staging. But you mentioned there's so much exciting research going on right now. Can we talk about that?
Oh, absolutely. That's where the real hope for the future of lung cancer treatment lies. There's some truly groundbreaking things happening in research right now.
Okay, well, I'm ready for a healthy dose of optimism. What are some of those promising areas of research you mentioned?
Well, one area that's generating a lot of buzz, and for good reason, is immunotherapy. It's a revolutionary approach that uses the power of your own body's immune system to fight cancer.
Immunotherapy. I hear that term a lot, but I don't really get how it works.
It's pretty clever, actually. The problem is that cancer cells are masters of disguise. They often evade the immune system by making themselves invisible to our natural defenses.
So they're like tiny ninjas hiding in plain sight.
That's a great way to put it. But immunotherapy is like giving our immune system night vision goggles, allowing it to see those hidden cancer cells and attack them.
Okay, so we're taking the blinders off our immune system, but how does that actually work? What are these night vision goggles made of?
There are different types of immunotherapy, but one of the most promising is called immune checkpoint inhibitors.
Immune checkpoint inhibitors. That sounds complicated.
Not really. Our immune systems have natural brakes, checkpoints we call them, that prevent them from overreacting and attacking healthy cells.
Right, we don't want our immune system going rogue and attacking everything.
Exactly. But those sneaky cancer cells can hijack those checkpoints. They send out signals that tell the immune system to stand down.
So they're tricking the immune system into leaving them alone, those little tricksters.
Exactly. But checkpoint inhibitors block those signals, release the brakes, and let the immune system go after the cancer full force.
So it's like taking the handcuffs off the immune system so it can finally do its job.
Exactly. And this approach is showing real promise in a lot of patients, especially those with advanced lung cancer.
That's great news. But I'm guessing there are still some challenges and potential downsides, right? No treatment is perfect.
Of course, like any treatment, immunotherapy can have side effects. Some people experience flu-like symptoms, fatigue, skin rashes, digestive issues, that sort of thing. And it doesn't work for everyone. But for many patients, the benefits outweigh the risks.
That makes sense. It's all about weighing the pros and cons and talking openly with your doctor. Okay, so immunotherapy definitely offers a lot of hope. Now, what about gene therapy? You mentioned it earlier, and it sounds like something straight out of a sci-fi movie.
It does sound futuristic, but it's becoming a reality more and more these days. Basically, gene therapy involves changing genes to treat or prevent disease. And in the world of lung cancer, it has the potential to be absolutely game-changing.
I'm intrigued. Can you give me an example of how gene therapy might be used to fight lung cancer?
One approach involves using gene therapy to deliver genes into those cancer cells that make them more vulnerable to traditional treatments like chemo or radiation.
So basically, we're weakening the cancer cells before we attack them with the big guns.
Exactly. We're using gene therapy to prime those cancer cells for destruction.
That's a fascinating strategy. What other gene therapy approaches are researchers looking into?
Another approach is using gene therapy to boost the immune system's ability to recognize and attack cancer cells, making it even better at fighting the cancer.
So it's like immunotherapy, but we're working at the genetic level to make the immune system even more powerful.
Precisely. It's all about outsmarting the cancer, using our knowledge of genetics to gain an advantage.
It's incredible to think that we might be able to actually reprogram our own cells to fight disease. It's mind-blowing.
I know, it's really exciting stuff. Of course, gene therapy is still in its early stages, and there are challenges, but research is moving so fast, I'm confident we'll see big breakthroughs in the next few years.
This is giving me so much hope for the future of lung cancer treatment. Are there any other groundbreaking advancements coming up that you're particularly excited about?
You bet. We touched on liquid biopsies a little bit earlier, and I think they deserve a closer look. They're really changing how we diagnose and monitor cancer.
Remind me, what exactly is a liquid biopsy?
It's a way to detect and keep track of cancer using just a blood sample. Traditionally, biopsies involve actually removing a piece of tissue, which can be invasive and uncomfortable.
Right, that doesn't sound fun at all.
Exactly. But with a liquid biopsy, there's no need for surgery. Instead, we can analyze your blood for little pieces of DNA that cancer cells release into the bloodstream.
Wait, you can find cancer just by testing blood? I had no idea.
It's pretty amazing, right?
Yeah.
And it's not just about detecting cancer. We can also use it to learn a lot about that specific cancer.
Like, what kind of things can you learn from a liquid biopsy?
We can learn about the type of cancer, how advanced it is, and even how it might respond to different treatments. It's like having a detailed map of the cancer, all from a simple blood test.
That could completely change the game. It could make diagnosis so much easier and less stressful, and I imagine it could also help doctors personalize treatments for each patient.
Absolutely. That's one of the most exciting things about liquid biopsies. By understanding the cancer's genetic fingerprint, we can personalize treatments to make them more effective and minimize side effects.
That's incredible. Liquid biopsies could truly revolutionize how we treat cancer.
They really could. They're still fairly new, but the research is moving quickly, and they're already helping a lot of patients.
This has been such an amazing journey. We've learned so much from the basics of lung cancer to the most cutting-edge research. I feel like I've gained a whole new understanding of this complex disease, and I'm feeling a lot more hopeful about the future.
I'm so glad to hear that. That was exactly our goal, to give you the information you need, bust some common myths, and highlight all the incredible progress being made in lung cancer treatment.
You've definitely succeeded. So as we wrap up this deep dive into lung cancer, what are the main takeaways you want our listeners to remember?
I think the most important thing is that knowledge is power. The more you know about lung cancer, the better prepared you'll be to make good decisions about your health. So don't be afraid to ask questions, advocate for yourself, and stay informed about the latest advances in research and treatment.
That's great advice. And remember, if you have any concerns at all about your lung health, talk to your doctor right away. Early detection can make a huge difference, and your doctor is your biggest ally in this.
Absolutely. Early intervention is key, and remember, there are many support systems available for patients and families facing a lung cancer diagnosis. You don't have to go through this alone.
Well said. And to all of our listeners, thank you for joining us on this incredible deep dive into the world of lung cancer. We hope you found it informative, interesting, and maybe even a bit inspiring.
It's been a pleasure sharing this journey with you. Stay curious, stay hopeful, and keep learning. The future of lung cancer treatment is brighter than ever.
We're back for the final part of our lung cancer deep dive, and I'm so excited for this one.
You too?
Because we're talking about the future. Yeah.
All the cutting-edge research that's like revolutionizing treatment and giving patients new hope.
It's a really incredible time for lung cancer research.
Yeah.
I mean, the discoveries are coming so fast.
Yeah.
We're seeing things that used to be science fiction becoming reality.
Okay, well, I'm ready for a big dose of that optimism.
All right.
So, before the break,
Yeah.
we touched on immunotherapy.
Right.
But can we, go a little deeper into that?
Of course.
I gotta admit, I still don't totally get how it works.
It can be a little bit complicated,
Yeah?
but the idea is actually pretty simple.
Okay.
It's basically using your body's own immune system to fight the cancer.
Right. Our immune systems are already amazing at fighting things off.
Exactly.
They protect us from all sorts of stuff.
They do.
Viruses, bacteria, all the bad stuff.
Yeah, they're constantly patrolling, eliminating threats.
But cancer cells, they're sneaky, right?
Oh, they are sneaky.
They've figured out how to get around the immune system.
Make themselves invisible to our defenses.
Like little chameleons, blending right in,
Yeah.
hiding in plain sight.
So they're hiding out while causing all this damage.
Exactly. And that's where immunotherapy comes in.
Okay.
It's like giving our immune system X-ray vision,
Oh, okay.
so it can see those cancer cells
Yeah.
and attack them.
So we're basically removing the blinders from our immune system.
That's a great way to put it.
But how does that work? Like, what are these X-ray glasses made of?
There are different types of immunotherapy,
Mm-hmm.
but one of the most promising ones is called immune checkpoint inhibitors.
Immune checkpoint inhibitors. Okay.
Yeah.
Sounds a little complicated.
It's really not as bad as it sounds.
Okay.
So basically,
Yeah.
our immune systems have these natural breaks
Okay.
called checkpoints
Mixed points. Okay.
that keep them from going into overdrive and attacking healthy cells.
Right. Makes sense.
Yeah, we don't want our immune system going rogue.
No, but
Cancer cells, they can actually hijack those checkpoints.
oh, wow.
They send signals that tell the immune system to back off.
So they're tricking our immune system into leaving them alone.
Exactly. They're pretty sneaky.
Wow, those little tricksters.
But then checkpoint inhibitors come in and block those signals.
Oh,
So it releases the brakes
gotcha.
and lets the immune system attack full force.
So it's like taking the handcuffs off our immune system.
Yeah,
So it
exactly.
can finally do its job.
Yeah,
That's so cool. And you're saying this is actually working for lung cancer patients.
it is. It's been a game changer for a lot of people,
Yeah.
especially those with advanced lung cancer.
That's incredible. But I'm guessing, like, there are still challenges, right?
Of course,
Like potential downsides.
like any treatment, it can have side effects.
Okay.
Some people get flu-like symptoms, fatigue, skin rashes, stuff like that.
Right.
And it doesn't work for everybody.
Yeah.
But for a lot of people,
Yeah.
the benefits outweigh the risks.
Okay. That makes sense. It's all about, like you said,
Yeah.
weighing the pros and cons,
Right.
talking to your doctor.
Absolutely.
Okay, so immunotherapy, definitely a huge reason to be hopeful. What about gene therapy?
Yes.
You mentioned that earlier, and it just, like, it sounds like something out of a movie.
It does sound futuristic,
Yeah.
but it's becoming more and more real.
Okay.
So gene therapy basically involves changing genes
Mm-hmm.
to treat or prevent diseases.
Wow.
And for lung cancer,
Yeah.
it could be revolutionary.
Okay, I'm all ears. But give me an example. How would you use gene therapy to fight lung cancer?
Well, one way is to use it to deliver specific genes into the cancer cells
Okay.
that make them more vulnerable to other treatments.
Like chemo and radiation.
Exactly.
So we're like weakening the cancer cells before we hit them with the big gun.
Exactly. Priming them for destruction.
Wow, that's amazing.
Yeah.
Are there other gene therapy strategies?
Yeah, another one is using gene therapy to boost the immune system.
Oh.
So it can better recognize and attack the cancer cells.
So it's kind of like immunotherapy,
Yeah.
but on a deeper level.
Right, on a genetic level.
Yeah, like we're actually reprogramming the immune system
Exactly.
to be even better at fighting the cancer.
We're using our knowledge of genetics to outsmart the cancer.
It's mind-blowing to think that we might be able to reprogram ourselves
I know, it's pretty incredible.
to fight disease. That's amazing.
It is a really exciting field.
Yeah.
Of course, gene therapy is still pretty new.
Right.
There are some challenges to figure out,
Yeah.
but the research is moving so quickly.
Yeah.
I'm sure we'll see some big breakthroughs soon.
This is giving me so much hope for the future of lung cancer treatment.
That's great to hear.
Are there any other amazing advancements coming up?
Yeah, we talked about liquid biopsies a little earlier.
Right.
And
Right.
I think those deserve some more attention.
Okay.
They're really changing the whole landscape of cancer diagnosis and monitoring.
Okay, remind me, what exactly is a liquid biopsy?
So it's a way to detect and monitor cancer
Okay.
using a simple blood sample.
Yeah.
Traditionally, biopsies involve surgery
Right.
to remove a tissue sample,
Mm-hmm.
which could be invasive,
Yeah.
uncomfortable,
Yeah, I can imagine.
and sometimes even risky.
Right. Not something anyone looks forward to.
No, but with a liquid biopsy,
Yeah.
you don't need surgery.
Okay.
We just analyze your blood for these tiny bits of DNA that cancer cells shed into the bloodstream.
Wait, you can detect cancer just from a blood test?
It is pretty remarkable.
I had no idea.
And it's not just detecting cancer, it's about getting all this information about it.
Oh, okay. So what kind of insights can you get from a liquid biopsy?
So we can learn things like the type of cancer,
Okay.
how advanced it is,
Wow.
even how it's likely to respond to different treatments.
So it's like having a roadmap of the cancer
Exact.
without any surgery.
All from a simple blood test.
That could make diagnosis so much easier for people.
It really
It's
could.
less stressful.
And less stressful, yeah.
And wouldn't that also help doctors, like personalized treatment?
Absolutely. That's one of the most exciting things about it.
Yeah.
By understanding the cancer's specific genetic makeup,
Yeah.
we can really tailor the treatments
Right.
to be more effective and reduce side effects.
It sounds like liquid biopsies could completely change cancer care.
I think they have that potential.
Yeah.
They are still relatively new,
Right.
but the research is moving so fast,
Yeah.
and they're already helping so many people.
This has been an incredible deep dive. We've
Yeah.
covered so much.
We have.
From the basics of lung cancer
Yeah,
to the absolute cutting edge research.
the future's looking bright.
I feel like I've learned so much.
Yeah.
And I'm walking away with this like renewed sense of hope.
I'm so glad to hear that. That was our goal.
Yeah.
We wanted to give you the knowledge, bust some myths, and highlight all the amazing progress happening.
You've definitely done that. So as we wrap up, what are the like key takeaways?
I think the most important thing is to remember that knowledge is power.
Right.
The more you understand about lung cancer,
Mm-hmm.
the better you can advocate for yourself.
Yeah,
Stay informed about new developments.
absolutely.
Ask questions, and don't be afraid to speak up.
And if anyone's listening and they have any concerns
Mhm.
about their lung health,
Yeah.
talk to a doctor.
Talk to your doctor right away.
Early detection is so important.
It really is. Early intervention can make a world of difference.
And remember, there's a whole support system out there.
There-
Anyone facing lung cancer, you don't have to do it alone.
You don't. You have a whole team.
All right, well, thank you to everyone for joining us on this deep dive into lung cancer.
It's been a pleasure.
We hope you found it informative, engaging, and maybe even a little inspiring.
We're so glad you joined us.
Stay curious, stay hopeful, and keep learning.
The future of lung cancer treatment is brighter than ever.